everyone, I am Glodimay Polisica, a student nurse from Visayas State University. For today's video, we're going to talk about the cancer of the ovary.
The ovaries are the female reproductive glands. They consist of three types of cells: epithelial, germ, and stromal. When the cells in the ovaries grow abnormally, they develop into tumors that can be non-cancerous or cancerous. If cancerous tumors are not detected early, the cancer cells can spread from the ovaries throughout the pelvic region and continue to spread to the abdominal area and other organs. Determining the stage of ovarian cancer is very important in developing a treatment plan. At stage 1, cancer is limited to one or both of the ovaries. In stage 2, ovarian cancer extends to the pelvis area. At stage 3, ovarian cancer has spread to the abdominal region. And in stage 4, ovarian cancer extends into the liver or to locations beyond the abdominal area.
Family history is the most significant risk factor. Most cases are random, but 5% to 10% of ovarian cancers are familial. A family history in a first-degree relative, older age, early menarche, late menopause, and obesity may increase the risk of ovarian cancer. However, the most women who develop ovarian cancer have no known risk factors, and no definitive causative factors have been determined. Types of tumors. Types of tumors include germ cell tumors, which arise from the cells that produce eggs and are the most common cause of ovarian cancer in women younger than 20 years. Stromal cell tumors, which arise in connective tissue cells that produce hormones. And lastly, the epithelial tumors, which originate from the outer surface of the ovary. Most ovarian cancers are epithelial in origin. Of the many different cell types in ovarian cancer, epithelial tumors constitute 90%. Germ cell and stromal tumors make up the other 10%. Clinical manifestations. Symptoms of ovarian cancer are nonspecific and may include increased abdominal girth, pelvic pressure, bloating, back pain, constipation, abdominal pain, urinary urgency, indigestion, flatulence, increased waist size, leg pain, and pelvic pain. Assessment and diagnostic findings. Any enlarged ovary must be investigated. Pelvic examination often does not detect early ovarian cancer, and pelvic imaging techniques are not always definitive. Diagnostic tests may include an MRI scan, transvaginal and pelvic ultrasound, chest X-rays, and a blood test for CA-125. An abdominal CT scan with and without contrast may also be used to rule out metastasis. Determining the stage of ovarian cancer is very important in developing a treatment plan. These are the main stages of ovarian cancer. First, cancer is contained within the ovary or ovaries. Second, cancer is in one or both ovaries and has involved other organs within the pelvis. Third, cancer involves one or both ovaries and one or both of the following are present. First, cancer has spread beyond the pelvis to the lining of the abdomen. Second, cancer has spread to lymph nodes. The stage 4 is the most advanced stage of ovarian cancer. Cancer is in one or both ovaries. There is distant metastasis to the liver, lungs, or other organs outside the peritoneal. Medical management. Ovarian cancer treatment typically includes surgery, chemotherapy, radiation therapy, or a combination of therapies. Surgical staging, exploration, and reduction of tumor mass are the basics of treatment. Surgical removal is the treatment of choice. Likely treatment involved, for example, TABSO, or a total abdominal hysterectomy with removal of the fallopian tubes and ovaries and possibly the omentum. Chemotherapy. Chemotherapy is usually administered intravenously on an outpatient basis using a combination of platinum and taxane agent. Nursing diagnosis. Major nursing diagnosis may include the following: anxiety related to diagnosis of cancer, fear of pain, possible perception of loss of femininity or childbearing potential. Disturbed body image related to altered fertility and fears about sexuality and relationships with partner and family. Acute pain related to surgery and other adjuvant therapy. Deficient knowledge of the perioperative aspects of hysterectomy and post-operative self-care. Nursing interventions. Relieving anxiety. Anxiety stems from several factors: unfamiliar environment, the effects of surgery on body image and reproductive ability, fear of pain and other discomfort, and possibly feelings of embarrassment about exposure in the perioperative period. The nurse determines what the experience means to the patient and encourages her to verbalize her concerns. Throughout the preoperative, post-operative, and recovery periods, explanations are given about physical preparations and procedures that are performed. Relieving pain. Post-operative pain and discomfort are common. Therefore, the nurse assesses the intensity of the patient's pain and assists the patient with analgesia as prescribed. Prognosis. Although the 5-year survival rate for ovarian cancer has improved significantly in the past 30 years, the prognosis for ovarian cancer remains poor overall, with a 48.6% 5-year survival rate. That's all for today. Thank you for listening, and may God bless you all.